Hello, welcome to the Let's Talk Kids Health Live Show, episode 63. I'm Dr. Nerissa Bauer, your host. I'm a behavioral pediatrician and CEO of Let's Talk Kids Health. As you know, the concept of this show is to share information about behavioral health, parenting, and family wellness. Each week, I bring you topics and guests to help me advance this mission so that we can all talk together. Now, let us know that you're here by commenting, asking questions, and liking this post at any time. And in a little bit, your questions will be asked of my guest. Now, the replay will be immediately available after the broadcast. However, we're also going to be rebroadcasting each episode every Thursday night at 8 p.m. on YouTube and Facebook. Please share the episode with anyone you think who would benefit. And if you don't want to miss future episodes or maybe check out my past ones, please subscribe to my YouTube channel, NerissaBauerMD, and follow my blog Facebook page, Let's Talk Kids Health, and join my free parenting discussion group. Now, today's topic is all about eating disorders with Dr. Tolu Alugo. Dr. Tolu is a child and adolescent psychiatrist based in Saint John, New Brunswick, Canada. She helps parents and educators to raise emotionally healthy children. She is the founder of Saintjohncapp, where she provides education on youth mental health, and is the creator of the Emotions Ambassador Program, an initiative aimed at helping kids learn more about their own mental health. And we're going to talk about that too at the closing. And so I'm so excited to have Dr. Alugo on because I've not yet had anybody talk about this topic, and I think it's so important. Welcome to the show, Dr. Tolu.
Thank you very much. Good afternoon. Thank you for having me.
I am so excited to have you here. Oh, and we have somebody saying hello. Hi.
Hi.
So glad to have you. Thanks for saying hello. So let's set the stage here because I know that you're a practicing psychiatrist and you normally treat kids and teens in your practice. Can you let us know, like, what are you seeing in terms of eating disorders? Is that a new thing? Is it rising, staying the same?
It's not a new thing, but it's definitely rising. I think with the pandemic, we were looking out for anxiety and depression to increase, but surprisingly, we've seen an increase in eating disorders. Kids restricting their diets, admissions to hospital for the same reason have also increased in numbers. So it's an increasing concern.
Yeah, and I'm really glad that we're going to talk about this today because you mentioned anxiety, you mentioned depression. Obviously, those two things can go with an eating disorder, but I think it's really just important to shed light on this topic. And so I think what we should start with is kind of at the bare minimum is like, what is a healthy dietary intake for kids or teens?
So a child or a teen should be eating all food groups.
Hmm.
So a meal that comprises carbohydrates, proteins, fruits and vegetables, enough fluids, and eating in enough quantity that they're full.
Hmm.
You also want to encourage them. I mean, I won't go into calories, but based on their age and their physical exercise, there are recommended ranges that you'll be looking at, for example. So, really, a healthy dietary intake is one that comprises all food groups in appropriate quantities, obviously, healthy options, but also the ability to have treats occasionally. I think it's normalized eating to eat healthy, but occasionally allow yourself to have treats.
Hmm. Yeah, and that's good. I mean, obviously, with anything, I mean, whether it be food, sweets, or even screens, or all of that, we always talk about moderation, right? So I think that's a great starting point. So, I mean, I think at issue is, thinking about how can we actually help our kids have a positive relationship with food? Because I think that's where I think all of us need to first start before we then talk about when it goes wrong.
I mean, from a very young age, it's important to expose a child to all the food groups so that they're comfortable with it. So, in our kitchens, make sure you have a wide variety of things for them to try.
Hmm.
And look, sometimes kids can be fussy when they're much younger, but keep introducing till they get used to the variety. You want to model healthy eating, so they're watching you choose what you're putting on your plate,
Hmm.
helping with the planning of the meals, with preparation. Um, if you go out for a meal, they're seeing what you're ordering. All those kind of, modeling healthy eating, watching you not talk about diets or your weight so much, where they're thinking, oh, it's bad to have this meal or it's bad to eat in such a way. So those kind of things would help a child have a healthy relationship with food, where they know that, because kids kind of look up to the adults in their lives for forming their own belief system and comfort level with things. So if their parents are happy to eat all food groups in healthy portions, eat in different settings, then they feel this is safe, and therefore that becomes a part of their own normal behavior as well.
Yeah, and certainly what we consume, what we prepare, sort of is what kids will eat, because that's what we're putting in front of them or having them the opportunity. But what I like that you said there is that, you did say something along the lines of, you have to give kids the opportunity to try something again and again, because it's not,
Hmm.
you know. We have to, I often tell my kids in my class that, we have to at least try something at least 10 times before our brain really knows if we like it or not. So,
True.
yeah, but I love that concept of, parents, you're modeling, you're showing your kids through your own actions, even if you don't actually talk about it. But so now that we know kind of why it's important to have a positive relationship with food, and I love your tips about like not necessarily talking as much about like diets or, our focusing so much on physical appearance. But what are some signs that a child has a disordered eating pattern? Because at the heart of it, that's what eating disorders are.
Exactly. So I mean, at this the commoner end of the spectrum, by the time they come to see a mental health professional, is when they've already lost a lot of weight. But the earlier days, some of the things you may notice is a child, cutting out particular food groups, maybe deciding they won't have butter, or they won't have full fat milk, for example, or they won't have any snacks or sugary foods. That you may notice that they're not eating with the family. They're refusing to go out to hang out with their friends, because hanging out involves having to stop at McDonald's, for example. So they're withdrawing from friends and family. They may begin to use eating, like, have smaller portions at meal times, or they may use, like, they may plate their food in a different way, like maybe use a saucer instead of a real, if regular meal plate, or use a
Mm,
side plate. They may eat with a teaspoon, for example. So they kind of, or they may cut their food into tiny bits, so that, and then take longer to chew their food, or drink lots of water before they actually have their meals. So the way you just notice those slight changes, you may notice that they're wearing baggy clothing and
mm,
trying to hide their body shape, or a lot of body checking. So wanting to weigh themselves all the time. Every time they pass by a reflective surface, they're looking at their tummy, looking at but they're pinching themselves to show how much excess so fat is there and stuff like that. So those kind of behaviors. Or a child with bulimia, for example, may be running to the washroom after every meal
mm,
for long periods of time. And then as time goes on, you then begin to see the physical changes from the dietary restriction or the vomiting that may be happening with bulimia. But that is when things have already become quite entrenched.
hmm. Yeah, so those are great warning signs, I think. So, just for those of families and people watching or listening to this, can you just quickly define like what's the difference between anorexia and bulimia?
Okay. So maybe I'll start first with of just to kind of see what an eating disorder is. So
Yes.
an eating disorder is really, it's a mental health disorder where there is a lot of preoccupation with eating, with weight, with body image, and the individual kind of, um, they evaluate themselves based on their body image. That is how they rate how well they're doing, or how they judge their lives. And there you may have two different, you have, well, I mean, two big categories. There are more than two, but the two commonest categories is anorexia and then bulimia. So with anorexia, it's dietary restriction, is weight loss or failure to gain weight. So, we're talking about children here, that they should be reaching particular weight milestones, and if they are failing to do so because they're restricting their diet, either because they're cutting out food groups, or they're compensating after they eat by exercising, Or with bulimia, what you see then is a child eating large amounts of food in a short period of time. So they're eating huge quantities of food, and then they compensate by either making themselves sick to get rid of the food, or they're over exercising, or beginning to use medications to get rid of the food, like water pills, like laxatives, and different ways to get rid of the excess food so they don't gain weight. With anorexia, you may actually see the weight loss, and they just look really skinny, and a lot of other physical things that we can go into later on. With bulimia, it's a bit more difficult because the weight might actually look normal
Mm-hmm.
because they're eating a lot and then getting sick. But then there are other physical things that may show up, like they may have swollen cheeks from like the parotid glands may get swollen. They may have rotten teeth. So the difference between bulimia and anorexia is that in bulimia there is that compensatory behavior to get rid of the large amount of food they've eaten in a binge eating
Mm-hmm.
episode.
Mm-hmm. Okay. And what are the age? I mean, what age do eating disorders usually occur?
Most commonly, it's in time of puberty. So
Mm-hmm.
from 12 onwards, we begin to see, that self-conscious about body image, and then it becomes more. But it can be a lifelong disorder. I
Mm-hmm.
mean, so some of them would persist into adulthood. But from about the age of 12, 13, you begin to see
Mm-hmm.
them developing.
When you're seeing a client, I mean, what are some of the other things that you usually ask about? I mean, because, I mean, do you, is there a particular cause for this to
Um,
develop?
the, the causes are multifactorial, so many things there. I mean, in mental health, we talk about the psychosocial model, which means so bio is kind of like a genetic vulnerability. Is there something in the family, a family history, for example, or have they got another mental health disorder that's kind of complicating the picture?
Mm-hmm.
Then psychological would be like low self-esteem. Um, this sometimes if things are going on in their social environment, like this may be the one thing they can control. So, for example, they may have undergone changes in the family setup, maybe like a recent separation or divorce, and there is just so much happening, and this is the one thing that they feel they have control over.
Mm-hmm.
Also, cultural things like we know TV and social media, there's this drive for thinness. So sometimes they're looking at social media, looking at people on, look at all the airbrushed images of models, for example, and they're aspiring to that. So there's that drive to look a particular way in the society. There's the body shaming that happens if you happen to look a bit more overweight than people think you should look. And
Mm-hmm.
then particular sports, for example, I mean, some people who are involved in like ballet, for example, or dance. There's some particular extracurricular activities. Some athletes, for example, are just at higher risk of developing an eating disorder because of the extra pressure and the expectations of how they should look.
Yes, or like weight categories or things like that.
Yeah,
Yeah.
exactly. Yeah.
Yeah. So, I mean, I'm glad you brought up, social media, and you specifically said that we're looking at airbrushed pictures, and our teens probably don't know that. They just assume that, oh my gosh, how is that possible? Like, how does that person have that much gap between their thighs? And mine doesn't look like that. I mean, those questions come up. Can you also describe, like, or give some tips for parents if they're concerned about a possible eating disorder? How would you suggest that parents start that conversation with their child? You know?
Well, I think, I mean, once they've begun to observe that things are not going as well, so
Hmm.
maybe even before the conversation, it's things like trying to incorporate some healthy habits, like saying, okay, let's begin to have meals together.
Hmm.
Let's begin to sit at the table together. So that way you're seeing what they're serving, and then you can now say, how come you're not eating as much as you used to eat? Or why aren't you having any meat? Or why aren't you having any potatoes? So that way, because you're observing the changes in their behavior, that can be your launching pad to talking about it. Or if you notice they're exercising, you might say, okay, maybe I'm going to go on this walk with you. And then, "Well, I notice you're walking a lot. So what's going on?" So, if you begin to participate in their everyday lives and then use that as an opportunity to find out what's going on with them and what they're trying to do,
Yes.
and trying to steer them back towards what should be healthy exercise, healthy meal intake. But if you notice that it's then becoming a tussle and they're hiding things or they won't eat with the family, that it's time to try and get, go the next step and get some professional help
Okay,
in.
thank you for that. I love that. I think, just using everyday moments, spending time with your child or teen, observing them, but then using those moments as springboards to discuss. Now, if you're watching this and have questions or comments, please don't be shy. And in a little bit, I can ask those questions or comments also and share them. So I guess if let's say there is a concern and the family talks to the pediatrician or a specialist, what sort of treatments or what should families expect in terms of treatment? Is there a way to help them understand what's next?
So the treatment is usually a multidisciplinary treatment. So
Hmm.
depending on at what stage the child is at, how unwell they are, usually the aim is for you to treat as an outpatient. So which means they don't have to go into hospital. That's the preference where
Yes.
things are not very severe. So you'd expect there will be a team of a pediatrician looking after the physical health, checking on the weights, making sure that all the labs are fine. Because remember that when they're restricting their diet or making themselves sick, they're losing important chemicals, they can become quite dehydrated, and that is what can lead to death actually. So it can be a fatal condition. So having a pediatrician on board, making sure the physical health is fine, that would be there. Then you'll have a psychologist or somebody who does talking therapy, trying to get into the reasons for weight loss, what's happening, what's going on at school or at home, managing their thinking about their body image. So you'd expect there to be some talking therapy either through a psychologist or someone who is trained in doing talking therapy.
Hmm.
Then if they have a coexisting mental health condition, which is very common, like having anxiety or depression, you might also have a psychiatrist on board looking at treating those conditions. Very commonly, you'd have a dietitian. So dietitians would help with meal planning, would help with kind of helping to structure what they should be eating, trying to make sure they're eating all the food groups in appropriate quantities. So it's usually a team effort. And so those are the main people that you would have. And obviously, in children, we always want parents to be involved. So it's usually family-based therapy,
Hmm.
because the first port of call for refeeding a child who has been restricting is the parents. You are the best ones to refeed your child. So the whole team is helping you learn how to refeed your child, how to get healthy eating and healthy exercise back into your homes. And so people will be working with the family as a whole, depending on the age group of the child. That's usually how we would approach it.
Hmm. So it's obviously better to catch these early so that it can be managed in an outpatient setting. But for those that maybe aren't adherent, to outpatient therapy, or it's gone on longer and there are certain health changes, what would lead to an inpatient stay, and what would that look like?
So if they were really physically compromised, where they were having things like a very low heart rate, where they were very significantly dehydrated, where they're having dizzy spells, unable to walk up the stairs, can't brush their hair, just physically really run down, then you'd want to admit to hospital, really just to get their physical health back to a safe place,
Hmm.
and then again back out to the community. Or where the the co-occurring mental health disorders are so entrenched, where they're so anxious, every mealtime is war, where the parents just cannot feed them at home, where where there's depression, thoughts of suicide. Some teenagers will say, look, I'd rather just end my life than have to eat. So when they get to that point, then they will need to think about hospital care just to stabilize things, and then back out to the community again. That's usually the preference.
Hmm. Yeah. And do eating disorders, from your perspective, does it affect females more than males, or do boys get this as well?
Boys get it. Well, I mean, females definitely way more. I think the
Mhm.
ratio is about 10 to 1,
Mhm.
but boys do get it. And I think because of the societal, the stereotyping that happens, people think it's mainly women. So the boys sometimes are caught much later, because they
Yes.
tend to hide it, they're embarrassed about it. But yes, boys do get eating disorders.
Yeah, I mean, there's competitive gymnasts, swimmers. I mean, yeah. So nobody is immune to this, but I think
No.
the key here is to always be looking for that. Also, I was curious to know in terms of, long term, after resolution of this immediately. I mean, once a child has been identified as having an eating disorder, is this something that they have to constantly battle with as they get older, or is this like treated and then done?
It varies. Some people do well,
Hmm.
and it resolves with a lot of support from family, from professionals. But about 50% may persist into adulthood, or you may see it wax and wane. So where they go through some years of doing well, and then in adulthood they may experience a life change or stress, and then begin to go back to those patterns again. But I think once a child has had an episode, it should always be at the back of the professional's mind or the family's mind that they're at risk of going down that route again, and to just keep an eye out for it.
Yes. Okay. Well, and so I guess if we can kind of talk about then some resources for families in relation to eating disorders, and then we're going to talk about the other part of your business too that you're doing. So, what sort of resources would you recommend to families if they're concerned about eating disorders and where to go for help?
So in Canada, there's the National Eating Disorder Information Center, NEDIC, so nedic.ca. There is also, I think, in the US, the National Eating Disorder Association.
Hmm.
They also, so both of these organizations have information leaflets, and resources, links to providers, at least NEDIC does.
Hmm.
Then also the American Association of Child and Adolescent Psychiatry, ACAP, has information leaflets as well for parents and for youth on different mental health disorders, including eating disorders.
Okay.
And so those are a good place, to get information and to also, get direction as to where to go from here.
Okay, great. And I love that you obviously talked about the importance of prevention, having a positive relationship with food. But parents, if you're watching and you have some concerns, please reach out to your child's pediatrician is a good place to start, family physician, obviously. And then, it's a team approach, as you said, Dr. Tolu. It's a team approach. So thank you for all that information. And again, if you have questions about this, please feel free to put it in in the comments right now. But again, take any of this information that was shared today. If you have concerns, always talk with your child's doctor and the rest of the team. Okay. So, but before I let you go, I am so excited to just hear more about, the work that you're doing. In our bio, when I introduced you, we talked about how you're developing a course for kids. Can you talk a little bit more about that?
So I'm developing the Emotions Ambassador program. It's a program to help youth become more emotionally aware. So there is a junior program and a senior program, and it's really, in the junior program, for example, is about 8 modules that discusses what emotions are, what are healthy emotions, what are the ingredients for our emotions, the effects of friendships on emotions, importance of healthy exercise, healthy diet, communication with families, why people feel anxious, why people may feel sad. We discuss relationships as well.
Mhm.
And then also about learning and different ways that people learn and how that affects how they do at school. The senior program will incorporate all of that as well, but we'll talk about substance use, eating disorders, healthy relationships, and how to get help when you're struggling.
Yeah. And, I love this because anything that we can do to preventively help our kids understand the role of emotions is really important. And it's very linked to what we were just talking about today. In fact, we actually have a question that came in. So thank you for posting this. So, how do you help children with emotional eating? Do you have any tips or strategies there?
Well, I would say that you want to try and get them other coping strategies. So you know that this child, when they're upset, they would eat a lot of food. Then maybe it's time for you to say, okay, you're feeling upset. Maybe we should take a walk together. Maybe we should do something different, do something else to self-soothe. So they are soothing by eating. So could they maybe have a warm glass of milk? Could they take a warm bath? Could they do some self-care, go on a walk, do something different? To so food isn't the only way they soothe themselves. Provide other outlets, and if possible, do it with them. So that way they learn that these other ways can help them to calm down without it always having to be food.
Do you have any advice for the person who posted this question in terms of like talking about their child, with the fact that I've noticed that whenever you get upset, you start eating, but maybe we need to, like how would you even start that conversation? Would you point it out?
Well, it depends. I think at a point you should kind of say, I notice you're upset, and so is that why you're having this snack? Or are you hungry? And then okay, so well, this is good, but could you also try this instead? So just give them other things without making it look as if the fact that they're eating is a problem, because you don't want them to feel like they feel guilty because they're snacking when they're upset. But you could just say, so there are other things we could try that may also be helpful, without pinpointing the eating as an issue, because that I see that happens sometimes with parents saying, "Are you going to eat all of that?" And then the child then begins to hide it. But if you just provide other things they could do when they're upset, so that eating is not the only thing, and then that kind of draws them away from using that coping strategy.
Yeah, no, that's a great answer, and again, a very fine line, I think. And parents, if you find yourself like saying that, I mean, again, it's like in
Yeah.
the moment we all say things,
Oh
right?
yes,
But
definitely.
it's yeah, but it's just, again, when you're calm, you can come back to that and just say, you know what? Maybe like I need to just understand what's happening. Can you help me understand? So that way I know how to help you, right? So that's great. Hopefully that answer was helpful, whoever posted that. So thanks for posting that question. And then also, I guess the one more question that I have in thinking about your ambassador program, your emotion ambassador program. I mean, what got you really interested in that focus of emotions and working with kids in this way?
I think, I mean, in my work, I'm seeing kids at the end of the spectrum where they're already unwell, and I just believe that you want to catch people early, intervene early at the point of before they become really unwell and having to go to, say, a psychiatrist. So by promoting healthy mental health, emotional awareness of, so they understand why they're feeling the way they are. They understand that anxiety can sometimes be healthy, and when it's unhealthy, they can catch it early by trying other strategies. So the hope is that with early intervention, early recognition, then fewer kids will get to the point where they're needing, to go see a professional because they're then very unwell.
Yeah. And I love that. It is so commendable. And I love, because like what you're really saying is that we recognize that mental health is on a spectrum, and we want our kids to be able to have at their disposal the healthy tools and the knowledge so that they can start taking care of themselves and promoting wellness rather than always kind of catching up,
Yes.
right? When it becomes too much and hard. So I think this course that you're developing for kids and teens is such an alignment with what we're talking about today. Yeah. Oh, yep. I know. Love that. Prevention is always better. Yeah, exactly. So where can people find you? So that way they can get updates on when this course is available and what else you're up to.
So I'm on Instagram, Saintjohncapp. Also, my Facebook page is also called Saintjohncapp. So that is Saint John with a cap with a double P.
Uh-huh.
I have a website, www.saintjohncapp.com, and there I have a blog where I talk about parenting, particularly about parenting through mental illness. So where most people walk on eggshells when their kids have a mental health diagnosis. So I provide tips for parenting a child with a mental health diagnosis on my blog. So those three places would have information about the course when it's going to launch. I also have a YouTube channel where I talk about different mental health disorders in youth, strategies for helping with different mental health disorders that people would notice in their kids.
Gosh, I love the work that you do. I'm so glad that we connected and that you were able to come on the show today to talk about this important topic. So, parents who are watching, or if you're watching this on replay, feel free to leave any questions and comments and just put hashtag replay so that I know that we didn't get to answer it live, but we'll always be monitoring this feed so that if there's any questions that I can answer and or ask Dr. Tolu to answer, I will absolutely ask her for those responses. So, again, share this episode with anyone you think who could benefit, and then make sure to watch out for the replay at 8 p.m. this week. So thank you so much for that discussion and for bringing awareness to this, because again, I think there's so much about parenting that doesn't happen by the book. And when it's your own child and you start seeing patterns that, are concerning, parents oftentimes don't really know what to do or what they should be concerned about or who to talk to about it. So thank you for coming on the show to share your wisdom and your expertise with us today. It was really helpful. Thank you.
Thank you very much for the opportunity. I've enjoyed having this chat with you.
Thank you. And those of you watching, I'll just share with you, my next week's guest is going to be Dr. Kara Uwe, who will be chatting with me about sleep in the teen years, and specifically why the teen years are a perfect storm for sleep issues. So you won't want to miss that. And then also, if you have any other topics or guests, or if you yourself are a specialist and care about kids' health, please reach out to me. You can send me an email at drnerissa@letstalkkidshealth.org, or reach out to me on any of my social media platforms, because I'm always checking them. And that way we can connect and get you on the show. Again, I'm going to show the resources here one more time that Dr. Tolu has suggested, as well as the American Academy of Child and Adolescent Psychiatry. I'll go back and put those links in the video description, so that way if you would like to just click on it, you can. But again, just make sure to always talk to your child's team about any information that you learn about during any of these programs. All right. Well, thank you so much, everybody, and we'll see you again next week. Bye-bye.
Bye.